Back, our final segment here on WAJR's Ask the Experts. Tony Caridi with Dr. Jacob Conjeski and Mark Hose. Mark's from Physical Therapy World at HealthWorks Rehab and Fitness, and Dr. Conjeski is with Mountain State Orthopedics. We've been talking about physical therapy and joint replacements, running through the normal process that takes place as someone deals with the potential of a hip or a knee replacement to the point of having the surgery. Now let's pick it up after surgery is over. I asked you in the last segment there, Mark, how soon after do they come see you? So you do the initial, but then realistically, what is the world like for someone after they had the process? Jacob had said about a 3-month window before you get back to normal. How's that normally work? How often do folks come see you? How much of it is in clinic, out of clinic?
So normally we'll see our patients about 3 times a week. And I kind of go with the basic, PT rules, pain, range of motion, strength, function. We want to control their pain and their swelling, and we'll do that with different techniques with edema control, with some compression, and use some like E-stem for pain control. And then, we're working on getting the range of motion back, especially with total knees. They are usually limited with range of motion, so we have to get that motion back. As the motion and stuff improves, the strength will start getting better, and we work on that. And over time, we start improving their function because, again, most of these people have had issues prior. That's why they are getting their joints replaced. So we got to get them back to what they want to do again.
What does a normal visit for PT entail in regard to time?
Usually, we'll see patients between about an hour to max is probably about an hour and a half, just with everything depending on what they're doing. But we try to get them in and out within that that hour time because everybody's busy. Everybody needs to do other things. So once we do set them on that that time frame, then we usually set them on a home program on the days they're not there, so that they can work on stuff like their homework when they're not there, so they can continue to improve.
Before they get the green light to be released from physical therapy, what do you have them up to doing by the time they're almost ready to, you're done?
Usually goal is they're off most of their assistive device if they were off one, if they didn't have one prior. Motion wise, we like to see, full extension out of their knee to about 120 degrees. Hip normally is, normal motion with that. Good strength, good 4+, 5 out of 5 strength. Walking well and kind of getting back to what they did before, if they were, going back to work or just their normal, everyday life.
Dr. Konjeski, how long after the procedure do they come see you, and what are you looking for at that point?
Well, our first post-op appointment's 2 weeks after surgery, and basically I just want to check the wound, make sure things are coming together nicely, no signs of infection, and overall just see how they're doing, see how their therapy's coming along. I always stress the therapy at that point with the patients. I always tell them the therapy is just as important as the surgery. You could have the best surgery in the world, but if you don't do your therapy, the outcome's going to suffer.
Yeah. Surgery, as you said, has greatly increased the time of healing, and it's gotten better. Now put your crystal ball look down here. What's happening next? What's in your world? Where does this thing go from here? What's technology going to let us do?
I think we've already touched on some of the things. I think the big things that are coming is, our pain control has gotten so much better. We're doing better nerve blocks with the anesthesiologist, and that really helps with things like shorter length of stay, same-day surgery. They do better with their therapy. The implants are getting better. I think the technology is going to continue to get better. I think the longevity of the implant is going to continue to increase. And then our techniques are always improving. We're doing more and more minimally invasive style of surgery, which helps speed up the recovery.
I'd asked you this before we started recording here today. Normally, how long does a replaced joint last?
I'm comfortable with today's components saying 20 years.
Yeah, that's a. Have you done people that have had multiple done? I mean, in other words, second hip, second knee?
Oh, absolutely. The more of these that are done, the more of them need to be revised. So you have some of these people who've had their joints in, 15, 20 years, and the parts are just starting to wear out.
Yeah.
But that's also with joints that are 15 or 20-year-old technology also. So we don't know exactly how long the joints we put in today are going to last, but we think 20 years is a good estimate.
And a final thought, think about how much better it's gotten because, 40, 50 years ago, there were no joint replacements. People got older, they dealt with this, and it was just horrible, right? They would just be limping around for the rest of their life. Tough times. Yeah, tough times. Well, good work, guys. We appreciate that very much. Dr. Jacob Conjeski, Mountain State Orthopedics, Mark Hose from HealthWorks Rehab and Fitness. If you or someone that you know has a situation involving joint replacement, these are the folks to call. The number at HealthWorks, 599-2515. That's 599-2515. Guys, thanks so much.
Thank you.
Thank you.
All right, we're all done for this. Stay with us. We've got more coming up. This edition of Ask the Experts brought to us by HealthWorks Rehab and Fitness. More coming up here on WAJR.